Hi, and welcome. It's Dr. Amy, and I'm back today to talk about your heart, its anatomy, its blood flow, and its electricity. The heart's a muscle that pumps your blood around your body. So we all remember this from elementary school, right? The heart, the arteries, and the veins make up your circulatory system. Remember? So obviously, we don't have to tell our heart to beat, it beats automatically. And guess what? The nervous system that controls the heart is called the autonomic nervous system. Autonomic sounds like automatic. That's because the autonomic nervous system operates unconsciously, meaning your brain doesn't need to tell your heart to beat. It just does. First, let's talk about your heart's anatomy or its parts. First, we're going to look at the heart itself. So the maroon colored areas are the chambers, and there are four of them. The pink colored areas are the walls and the valves. The blue vessels are the veins. And why are they blue? Because this blood that's coming back into the heart is lacking in oxygen because it just gave up all its oxygen to all of your organs and tissues and cells. Okay, so it's coming back into the heart to fill up on oxygen via the lungs and get pumped back out into the body. And the red vessels are the arteries. So we enter the heart on the right side through the superior vena cava, which is the big blue vessel on top. It's the main vein that comes back into the heart. So that blood empties into the right atrium. Then it gets pumped through the tricuspid valve down into the right ventricle. So the blood leaves the right ventricle, travels through the pulmonary valve and into the lungs where it collects oxygen to take on the next trip around the body, right? So we're in the lungs, getting nice oxygen, and we take that oxygenated blood back to the heart and into the left atrium. The left atrium then pumps that blood through the mitral valve down to the left ventricle. And remember, that blood is nice and full of oxygen. Then that gets pumped out of the left ventricle through the aortic valve and through the aorta, which is the main artery of the body, right? So it's that big red vessel at the top. So it gets pumped out of the left ventricle through the aorta and out to the body. I want to mention here that the arteries that surround the heart muscle are called the coronary arteries, and they supply the heart itself with oxygenated blood. When plaque builds up and or a clot blocks the flow of oxygenated blood to the heart, that's what we call a heart attack, or an MI, which stands for myocardial infarction. That's what we in the healthcare business call a heart attack. Now, let's talk about the heart's electricity. So, when you come into the ER for chest pain, shortness of breath, abdominal pain, palpitations, or fast heartbeat, if you've passed out, which is what we call syncope, or dizziness, you'll get a test called an EKG or ECG. It stands for electrocardiogram. Okay, this is an EKG strip. And an EKG is a graph that shows the electrical activity as it travels from the top of the heart to the bottom. Now, each peak and valley represents how electricity is moving through the heart, and any deviation from the normal pattern, which is shown here on the screen, tells the doctor if there's some sort of defect within the heart muscle or the natural pacemakers of the heart, which is what we're going to talk about next. Okay, so here's a picture of the cardiac conduction system. So this system is a network of special cells that control the heart's rhythm and rate. Okay, so the electrical impulse starts in the SA node or sinoatrial node, or sometimes we just call it the sinus node, which is located up in the right atrium. Okay, so the impulse then spreads through both atria causing them to contract. Next, the impulse travels down to the AV node or atrioventricular node, which is located between the atria and the ventricles, right? So the top and the bottom. The impulse then travels through the bundle of His between the ventricles, which then divides into the right and left bundle branches. You sort of follow it down to the bottom. Then it travels down the bundle branches and out to the ventricles, causing them to contract. During the relaxation phase, the ventricles relax and the process starts again up at the top at the SA node. And that's it for today. I hope this video was a good refresher for you, and I hope that you learned something new about your amazing heart. Thank you for joining me. Always keep learning, always keep growing. I'll see you next time.